I studied regular Western academic medicine, but already during my clinical rotations, I was very disappointed with especially chemotherapy. I saw patients, in my opinion, dying because of the chemotherapy. So I studied acupuncture. I'm also a licensed acupuncturist. I studied homeopathy and also applied that as a medical student. But yeah, I was looking for more. How can I do it better? In 1976, I was diagnosed myself with cancer. So I had to go to the hospital and I wanted to be the operator. So they will first look under local anesthesia, and it was clear. My whole belly and later lungs with full metastases with what we now call germ cell carcinoma. At that time, they called teratocarcinoma. So it was very aggressive. My colleague said, well, I'm sorry, you take 4-6 weeks, maybe a little vacation, but that is it. And then I told me no chemo, no radiation. So I exclusively treated myself with mistletoe. I'm sitting here, it's now 48 years later. I treated myself with mistletoe, not really with hyperthermia because I was not prepared for that. Then cancer more and more disappeared. Now it's like 48 years later and I'm fine and can assure you without cancer. But it was a very aggressive form of cancer, germ cell carcinoma, poorly differentiated, so it was a matter of counting the days or the weeks. So therefore I got also interested to search more, because then suddenly, because I got a lot of cancer patients in my practice. We also started to research with dendritic cells. For dendritic cells, the Nobel Prize of Medicine was awarded in 2011. So we did it in the 90s and the early 2000s. We could develop a way to make dendritic cells, but nobody really knew exactly what that function was and how you maybe could make them, create them. We as a university in Göttingen in Germany and Vienna in Austria developed a way to isolate the monocyte, the sort of halfway stem cells, and we could make from them tens of millions of dendritic cells, and they were very fit and ready to go. I always like to compare dendritic cells with policemen. They look a little bit like an octopus. They have tens or sometimes hundreds of little tentacles. These dendritic cells crawl throughout your body, looking from your brain to your prostate, to your lungs, to your colon, looking for abnormal cells. And once they have found them, cancerous cell or a cancer cell, then they take a little biopsy of the tumor-specific antigen, and then they go quickly to the next lymph node, and you can compare the lymph node as, let's say, a military base. Because if you're healthy, then your lymph node is also full with natural killer cells. And they are like Marines, so to speak. But the killer cells will only kill cells if they are instructed for that. So the dendritic cell, they instruct killer cells, and it's amazing. One dendritic cell can instruct 3,000 to 5,000 killer cells. They're all giving a piece of this biopsy. So then they're very well informed, and then within 2 to 5 hours, they leave as a little army, they leave the lymph node. They also know the direction, and that is still not completely understood. And then they attack each cancer cell with this specific antigen. And then usually, depending on the studies you read, but between 24 and 28 hours, that cancer cell is killed. You will make several million cancer cells per day because of mutations that take place, especially nowadays, we're exposed to a lot of radiation and electromagnetic field. So we make per day millions of cancer cells. You can also find them, measure them, see them in the bloodstream, but also in tissue. But if your immune system is functioning correctly, then you never get clinical cancer. But we also have also a little bit of cancer non-stop, and it's part of life. Therefore, dendritic cells, very powerful. We can enhance the function, what we always do on the day that we give the patient back its own dendritic cells, so autologous tissue. We also, if possible, combine it with a fever, rain, total body hyperthermia. That means we go 1.5, maximum 2 degrees up in the temperature, and then we leave the patient alone, and then the immune system is really much activated, sort of woken up, if it goes through a fever period. It doesn't have to be high fever, but 1 degree up. So what you also have when you get the flu or cold, and then you will activate the immune system. Unfortunately, I notice even colleagues of mine, but also a younger medical doctor, always think fever is the cause of disease, but it's the opposite. Fever is a natural response to trauma, to stress. Therefore, you have to activate the immune system by just increasing the core body temperature 1 to 1.5 degrees. In a regular infrared sauna, you can increase the core body temperature high enough to also have this kind of effect. Germany made these bets and there's no risk. It's infrared, but you could say it is a little bit in the direction of also infrared sauna. It works so that within 2 hours, usually the core body temperature has been increased 1.5 to 2 degrees. All the people who went to complete remission never got cancer back after 18 years later because we can restore the immune system. And if you do chemotherapy or radiation, you keep getting follow-ups because usually it comes back half a year later. And then you get with chemo, radiation, and collateral damage. You also see that the standard treatment by itself causes cancer again, but maybe not the next day, might be half a year to 3-4 years down the road. And I've also had many patients who had breast cancer, were operated on radiation, that's always the standard, and then 2 or 3 years later, they had lung cancer in that area where they had the radiation. 96% of all our patients were hospice patients. They came to us when they had no options anymore. Now, I must say, 99% of all the patients with active cancer have a fairly low natural killer cell activity. What we could show that more than 80% had a complete restored natural killer cell function after 8 weeks of Mistletoe.